Okay, folks, here we go. I'm glad that you were able to join us today. This is going to be a very exciting webinar. We're going to learn a lot about hospital readiness. There, just like the title slide says, my friends, there is a clinical device explosion coming, unbelievably, and we're going to talk about, what is you're about to face. Is your Wi-Fi network ready? And we're going to talk about a solution as well that can help you prepare for this onslaught. My name is Eric Camuli, and I'm the Customer Success Officer here at Seven Signal, and I am joined today by Don Cook, our Chief Marketing Officer. Say hello, Don.
Hello, everybody. Good morning and good afternoon, depending on where you are in the world. We had a big registration. I just want to acknowledge some of our international partners and prospects that are on board with us today. This is an excellent topic, and we've got a wide range of titles ranging from C-level inside hospitals, wireless professionals, networking engineers. So we'll have a little bit of information for everybody.
Outstanding. Thank you, Don. Well, let's just jump right into it. We've got 45 minutes that we're going to spend with each other today, and this is really why we're here. We've identified, as just in looking at the space, that the hospital and healthcare market is really ahead of other markets when it comes to Wi-Fi, the explosion of devices, IoT. It's really being driven by healthcare. You know, Don, I was watching the latest Apple Watch introduction that took place a few months ago, or about a month or so ago. And, they were talking all about how the Apple Watch is, all of the use cases for medical and for hospital. It was just unbelievable.
Yeah, it's exploding. And, healthcare in the U.S. and abroad is just such a hot industry right now. So you're getting new products being brought to market all the time. And when you compound that, as an issue, in air quotes, and you compound that with the current issues in the market, whether that's deteriorating IT infrastructures or you've got EHR satisfaction issues in some areas, you've got connectivity problems, and you've got folks constantly complaining about the Wi-Fi, specifically to us. It really makes for a perfect storm in a solution like ours.
Unbelievable. And, perfect storm. Just, thoughts and prayers out to the people in Florida today for what they're going through with Hurricane Michael.
So diving right into this thing, we've got a focus here, and specifically to hospitals. And we enable our customers to focus on patient outcomes and not connectivity. So if you look at the hospital ecosystem from a task perspective, from the time a patient checks in and they start talking to a caregiver or a customer service person, whether they are talking about billing or they're getting into the treatments and getting into the CPOE or patient order entry. They're dealing with consults, orders themselves, labs, test results. They're coding for medical billing, or just the overall exchange of data. Really, every piece is now connected to its one way, shape, or form an IoT device. That could be a workstation on wheels. It could be a scanner. It could be a voice over IP device. The list goes on and on.
Yeah, I know. Anything. I remember talking to one of our hospital customers recently. He said basically anything that you can connect to a patient is running wirelessly. EKG machine, glucose monitors, the IV pumps, just like what you were mentioning a moment ago, the blood pressure monitors, unbelievable, as we see on the right side of the screen. On the left side of the screen, you'll see that it's a mobile device that's at the center of these communications. Notifications, the nurse call, getting in touch with the various resources around a hospital, including all of the telemetry that's required to really deliver great patient care. Mobility is at the center of it all.
And it also extends outside that ecosystem as well. So it not just at that point of care. So if you're looking at, if you want to review the history of medical dispensing, or if you want to track staff or patients or inventory, if you want to really ensure that care provider communications are enabled, that sort of stuff all occurs at that point in time as well. And this slide is perfect because it really puts a value on what it is that we're here to do today. And if there is a disconnected device or the network goes down in a hospital environment, what does it mean? So right out of the gate, you're possibly going back to paper, right? We're going back to the Stone Age. We're no longer able to use our electronic health record to record data. So that's got a ripple effect. So ultimately, that has an effect right out of the gate on caregivers and the ability to see patients. So they're seeing less patients during their shift. And we'll talk about more of that in a second. But that has an effect on patient satisfaction scores, and that's relevant because of Medicare and Medicaid reimbursement.
That's right. The HCAHPS survey is so absolutely critical. If hospitals are not getting good scores on the HCAHPS survey, it absolutely directly affects the amount of reimbursement. Unbelievable.
No doubt about it. That moves and dominoes into readmissions. So if the patient is not able to get critical data out of their side of the patient information record, they could come back for more care. And if they are admitted or readmitted, I should say, before that 30-day window, that costs the hospital because the hospital is not getting reimbursed for that care. Mm-hmm. Then you're talking about corrupt data causing patient issues, medical errors, increase during transitions of care, and we'll talk about more of that in a second. And ultimately, everything comes down to medical coding and billing. And that's impacted directly when data is not entered into the electronic health record or other information sources. You're not able to bill if you're not able to see that transition of care.
And it's absolutely critical. I mean, healthcare costs are very expensive. And there's actually a lot of consolidation taking place in the industry right now, and because it's a difficult business to be in from a cost and a billing standpoint. Right. So that's absolutely critical.
Hospitals are operating on 1% and 2%, sometimes a 0.5% operating margin. So there's not a lot of wiggle room there.
Unbelievable. Now, I wanted to get back to this patient care thing that you were talking about just a moment ago with the ability to see patients. I mean, this is one of the biggest things that affects the HCAHPS survey score. There are a lot of questions on that survey about the interaction between patient and doctor and the responsiveness and that level of relationship that they're trying to develop and build there. But just imagine this for a second, Don. I mean, if you've got a nurse and they're supposed to spend about a good 5 minutes per patient, then that means that approximately they're seeing about 12 patients in an hour. But imagine this for a second. Can you picture in your mind the impact on patient care if there was just one 5-minute Wi-Fi issue with the network?
Significant.
Yeah, think about that. Let's just say that you've got 50 nurses. Potentially, that's 50 patients that we were not able to see in that hour.
Because we're focused on connectivity and not patient outcomes, right?
Exactly.
Get back to the point.
Unbelievable. Now imagine I just said 50 nurses.
Right. Extrapolate that, doctors, other caregivers, customer service representatives, the numbers get big.
Yeah, exactly. Huge. And not only that, I mean, just from a cost standpoint, we're not only talking about, just one, this is just an example of one 5-minute issue in one day. I mean, imagine if this is happening twice a week, 3 times a week, 4 times a week. I mean, exactly. the numbers get huge with regards to how effective doctors, nurses, and clinicians can be with fulfilling their obligation of meeting with patients, helping them, providing the care that they deserve. Oh, look at that. It looks like it's trivia time.
Is that Alex Trebek?
It is Alex Trebek, and it looks like he's got a few questions for us, Don. Are you ready?
Okay, I'm on the hot seat. Okay.
Okay, yes, you are. All right, here we go. Are you ready?
Yes.
First question is, the percentage of serious medical errors that occur during care transitions.
I do know this one.
Oh, yes.
I believe the number is 80%.
Let's check. You are correct. It is 80. However, you did not phrase it as a question. And so therefore, I cannot give you points.
Money. All right.
I cannot give you any points for that. So yes, you are correct. 80%. Could you imagine?
That's a high number. So, I know how that transition of care and how that number comes about, because there's a lot of things included in that.
Yeah, transition, we're talking about not only patients moving up and down the halls as they move from department to department, but
it's also information transfer. So, aside from that physical transfer, so whether that's information being exchanged into an EHR or a collaborative software system like a Volt or a mobile heartbeat or Patient Safe or Vocera. So there's a lot of things out there that play into this mix.
Okay, well, we're going to give you one more chance. I think Alex has another question for you, Don.
Go ahead, Alex.
Or should I say another answer for you?
An answer for me, right?
All right, here we go. The percentage of hospitals who spend up to 500 hours per year on Wi-Fi maintenance.
500 hours per year on Wi-Fi maintenance.
Wow.
That's a big number. So 30%.
Would you like to phrase it as a question?
Higher. You say, okay. I saw your face here. So what is 30%? I'll go with 30.
Okay. What is 30%? Let's see. Oh my, no. The answer is what is 55%?
That's a big number. Okay. So 55% of our Wi-Fi engineers theoretically are focusing maintaining their networks.
That's right. 500 hours.
Yeah.
That is really unbelievable. So when we talk about the importance of a Wi-Fi performance management system, the importance of getting proactive with all of this, I mean, we're talking about patients, their care, really quite remarkable. And that is a great segue into how we just kind of talk about our products here. It is time to get proactive when it comes to our Wi-Fi networks, especially in the healthcare space. I mean, we have just spent the last 15 minutes or so, Don, talking about the critical nature, not the critical nature of care, and the requirements of that care require mission critical Wi-Fi networks to be up and all the time. If we can't be proactive with our Wi-Fi network and monitoring and managing it, then we can't be proactive with our patients. So again, the idea here is we want to focus on patient outcomes. As IT professionals, it's our responsibility to maintain that connectivity so that the rest of the organization can focus on patient outcomes.
Right.
And unfortunately, many of us are, feeling like this gentleman right here. When we're in reactive mode, what happens is the complaints come in, and now we're in a situation that it's very difficult for us to determine, is this a wired problem? Is this a wireless problem? Or is this a client device related issue? Oftentimes what you've got is somebody reporting that the Wi-Fi is down. And then upon and further inspection, after we go through this drop everything moment, we determine, it had nothing to do with the wireless network. Wouldn't it be wonderful to proactively see, okay, do we have wired issues? Are they actually wireless issues? Or, with all of the devices that we have in the hospital, with these workstations on wheels and such rolling around, it could actually be client device related issues. So the other thing is that we need to get out on the edge of the network. So traditionally, we've kind of had a centralized approach, but getting out on the edge of the network where we can see what the real user experience is, I think is key. And then finally, we want to be able to record what's happening on the Wi-Fi network so that we can look back and identify root cause. Many times Wi-Fi issues are reported after the fact. I had a problem yesterday. I had a problem last week. The ability to actually go back in time and then see, what did the air actually look like at that time is absolutely critical. Because Wi-Fi issues, they're like ghosts. They kind of appear and then they disappear, and they're very hard to track, causing the same exact frustration that our gentleman right here in the photo is displaying. So we want to remove that frustration. We want to empower IT professionals working within hospitals to quickly identify whether issues are wired, wireless, or client device related. And we want them to have the ability to be proactive.
And that's where we come in. So I'm going to talk to this slide a little bit, Eric.
Okay.
And it all surrounds around proven technology. So Seven Signal's been in this space a long time. And we have a global customer base to prove it. Over 13 years of experience, in fact, and over 100 man years of experience specific to Wi-Fi. So when you couple that with, and I should say, the largest devices under management number in the business at 4 million devices under management.
Oh, wow.
So when you couple that with a delivery as a software as a service model and all of the elements that we deliver around that continuous Wi-Fi performance management monitoring, whether that's roaming, interference, throughput, authentication, VoIP or MOS scores, RF, that full spectrum analysis, device management, and device histories, all delivered through one complete enterprise solution for the device or the entire infrastructure, really enables our customers to be proactive. And I should say that that doesn't mean adding another person to the staff to manage this. Proactive doesn't mean adding new people to the staff. That enables you to be proactive with the current staff that you have in place. So no, we're not talking about adding to a total cost of ownership for a solution.
Exactly. Instead of adding full-time employees, what we want to do is provide a system at a fraction of the cost that allows us to do the continuous performance monitoring that we're talking about here, bring problems to you instead of having them always coming at you. A big, big difference. So there is this traditional approach, legacy approach that we've all been working with for the longest amount of time since Wi-Fi really, since its inception. And that is what we call an inside-out approach. This is where we're going to look at our wireless LAN controller. We're going to look at the device where everything is central, and we're going to try to figure out what's happening with the Wi-Fi experience from that point of view. Now, this is the equivalent of looking at your Cisco Prime, your Aruba Airwave, whatever it might be. And these are great infrastructure points of view. They're going to give you the information you need to understand what your bandwidth utilization is, who your top talkers are on the network, which is fantastic. But I'll tell you what, there is something that's indeed missing. And that is visibility into what's really truly happening out there on the edge of your network where doctors and nurses and clinicians are actually trying to help patients. And so this is a critical piece that's missing. Our strategy here at 7Signal is let's not compete with the Ciscos and Arubas of the world. Let's complement what they're doing. And we feel strongly that we've got a good relationship with these manufacturers. And in fact, we are complementing what they do. Now, on the other side of the coin is the outside-in approach. And this is what 7Signal is going to deliver. So our first product that we're introducing to you today is what we call Mobile Eye. Mobile Eye is an app or an agent that's going to reside on the actual device in order to reveal the true experience that's taking place on the workstation, on the tablet, out there in the environment where it's interacting with the environment. And this is absolutely critical because as a result, we're able to get a tremendous amount of information. Call it Wi-Fi telemetry, if you will. In doing so, we're now able to identify if we have weak spots in our network where maybe there's poor signal strength or maybe there's some kind of equipment in the environment which is preventing a good reception, good signal strength. So we're able to see that. As we know, different devices roam differently. And so as a result, we're now able to characterize the roaming behavior of different workstations on wheels and different tablets and devices. Now, it is compatible with Windows, Mac OS, Android, and iOS. We have this on thousands of devices with those operating systems in hospitals. Very quick and easy to deploy. You would just push it out to these devices, similar to how you would push out any type of an update to the Windows Update operating system. And you can test to various endpoints in and around your hospital. We provide you with an endpoint that you can put into your environment. And that's going to help us do throughput testing. It's going to help us measure packet loss, jitter. In addition to that, you can put in whatever endpoints you want. So if there are certain servers that you want to be pinging all the time, if there are certain web pages that you want to be downloading all the time, think of it as like a heartbeat for Wi-Fi, where you're able to continually crowdsource this type of information in order to ensure that your people and their devices have the connectivity that they need continually and all the time. And again, this is completely SaaS-based, so there's really not much to do except just upload or download the software and put it on the devices. So that's the first product. The second product is what we call Sapphire Eye. Now, Sapphire Eye is a device that we here have created, and we call it a high-performance client because it's going to get onto your network just like a client, but it's going to stay in that location and basically monitor and watch over like a sentinel 24 hours a day what is going on in that environment. Now, the nice thing about the Sapphire Eye is that it does have some extra special capabilities. So in addition to measuring throughput, packet loss, latency, and jitter 24 hours a day, because it's a client, it also needs to get on the network. And as a result, we're able to now test the connectivity to the network. We're able to test the authentication to the network. And we're able to test the ability to get an IP address from your DHCP server, which is also a part of your network. So a lot of folks don't have good visibility into radius and authentication. They don't have good visibility into DHCP and DNS services. But if our Sapphire Eye, which is a high-performance client, cannot successfully negotiate those stages, those gates, and get on the network, you'll be instantly notified and you'll be able to spring into action before it impacts patient care. So this is a biggie. Now, another thing that we're able to do is, because it does have the additional capabilities, I'm sorry, if you will, the additional capabilities of the Sapphire Eye is that it does have a spectrum analyzer built into it. And so we're actually able to see what's happening in the air 24 hours a day. And we're recording that spectrum analysis data in the cloud for 90 days. So this is really remarkable. When you think about going back in time and seeing, whoa, what was going on in the air last Monday? We can actually now go into the system and see that there was some kind of interference that took place in this part of the hospital at this time, this day. Very powerful, very, very powerful. The other thing that we're able to do, and this is particularly important in a hospital, is measure airtime utilization. So as you all know, there is a limited finite amount of air that is in the 2.4 gigahertz spectrum and the 5 gigahertz spectrum. And we all have to share the air. Now, the thing is that because it's limited, if we run out of air, well, we all suffer, right? Figuratively and literally, we all suffer. And so airtime management, airtime utilization is an absolutely critical part of the solution. And again, we're able to receive performance alarms and alerts, enabling you to be proactive all the while. So let's just bring up this product lineup slide right here that we have. So on the left, this is just an overview of Mobileye. On the right, we've got Sapphire Eye. The two products work together in conjunction to provide you the best and most full featured coverage that you can get in your hospital. All of that data is going to be sent to the cloud where you log into IQ. And this is our intelligent system for monitoring and measuring. This is where you're going to get your reports, your dashboards, and all of that rich detail with regards to what's happening in the environment. Oh, there is one feature that I failed to mention with regards to the Sapphire Eye. We talked about the spectrum analyzer, but another great feature I'm remiss to mention is the remote packet capture capability. Think about this. You have hospital buildings that are all over town, that are all over the state, or perhaps even all over a certain part of the country. And as a result, it is difficult for you when there are issues reported to get into the car and drive over, or to dispatch a tech, somebody local, in order to do this. So what we're trying to do is provide you with a system that gives you everything you need centrally located so that you can see what's happening in that remote clinic, in that remote hospital, in that urgent stat care center that you have on the other side of town. You can see what's happening in the air. You can see what's happening from a throughput standpoint. If there's a spike in jitter, if there's a drop in packet loss or a spike in packet loss, you'll be instantly notified. And if worse comes to worse and you need to do a packet capture, just turn on packet capture remotely, suck down the PCAP file, open it up in Wireshark, and have a ball. So this is just a little bit of insight into our system and how it works. So imagine this. This is just a little conversation that somebody might be having, like a doctor with somebody in the IT department. You know, what they do is they may call in and say, hey, what's going on with the Wi-Fi? Why is it always so slow? And we can look up that person and we can look up their device. So in this case, we're looking up a laptop computer that maybe a doctor is using. Now look at everything that we have at our fingertips. We have all of the questions answered. I can see what network they're on. I can see what access point they're connected to. I can see what channel they're on, what band they're on. I can see their signal strength and their data rate. I can see whether or not they can reach the gateway. And I can also see how fast their connection is. And then look what we have here. I actually see in nice bright red that in fact the problem is web download time to the hospital website where certain resources need to be accessed. So just to continue here, it looks like that we're slow to the website. And then, you know, we finally get the doctor to fess up and say, yeah, you're right. It's always slow when I go to the website, so fix the Wi-Fi. But in fact, the IT professional now has the full story. And in basically 30 seconds or less here, we've been able to identify that it's not a wireless device issue. It's not a client device issue. Or it's not a Wi-Fi issue, but in fact, it's something happening with the back-end infrastructure or in reaching our website. And so we now know where to go in order to resolve the issue, as opposed to spinning our wheels in the mud continually trying to figure out what's going on. Here's another example of how we can troubleshoot an issue very, very quickly. So one of the things that 7Signal is able to do is actually monitor and measure the quality of the wireless LAN adapters and what versions of drivers work well and which ones don't. So here's a perfect example right here where we upgraded the drivers to a few workstations, and after we did so, in fact, the performance metric went down. It went way down. And so what's really remarkable here is that we're able to now identify who has that configuration. We identify the issue, we tell you who's impacted, and now you know to halt your upgrade plan. Now let me show you one more example of this, how powerful the system can be in helping save you lots of time. So with regards to analytics, remember, we're characterizing the performance of all of your workstations on wheels. So from a proactive standpoint, we just simply identify, okay, which workstations have the adapter and driver combination that's worst on my network. And remember, we could be dealing with 500, we could be dealing with 5,000 workstations.
Right, and always, you're not always notified at the time when the Wi-Fi issue occurs. Mm-hmm. So a report like this, you know, you can be proactive and say, okay, you know, maybe we need to look at these carts and have someone go down and change drivers, or you know, you actually have the data. And you don't need to get that phone call when the issue actually occurs.
Yeah, that's the amazing part. I would agree wholeheartedly. And you know what? Hospitals love this. We have a lot of hospitals who are currently using the software. They're using both products. They'll put Mobileye on those workstations on wheels, for instance. They'll put Sapphire Eyes in key locations and key departments around the hospital so that they can get 24/7 coverage and get the alerts and the alarms that they need when, like I said before, there's a drop in throughput or a spike in jitter that could be affecting patient outcomes, that could be affecting a nurse or a doctor or clinician's opportunity to do a great job. Oh, wow, look at that.
$20 Best Buy gift card.
Yeah, I didn't realize that this was coming down the pike, Don. Have you been holding back on me?
I was.
All right. Well, how is this going to work? We're going to ask a trivia question or something that we learned from today's presentation?
We are. We're going to ask the audience to recall one of the stats that we mentioned earlier. And on your control panel within the GoToWebinar, there's an area for questions. So while we ask this question, please think through some of the questions you'd like to ask us as well.
Yes.
But let's pull up this question for the $100 Best Buy gift card.
Okay, here's the question. I hope everybody's ready out there. What % of medical errors occur during care transitions?
Oh.
Do you remember this? This was one of our Jeopardy questions, was it not?
It was. So there are actually some answers coming in here. So we haven't gotten the right one yet.
Oh, we haven't. Okay.
All right, I think we've got our first correct answer.
Okay, hold on. Let me see. What is the correct answer? Let me bring it up on the screen. It is 80%.
And Andy Gallagher was the first correct response.
Oh, fantastic. Andy, thank you very much. And Don, I assume you'll be taking care of Andy with this gift card because I don't have a gift card.
I will. Andy, I've got the gift card in hand, and we'll get that out to you immediately. So you can buy something nice.
That's fantastic. Like maybe you can go towards your new wearable device.
Yeah.
Okay, let's continue on here. And it looks like we've reached our question and answer session. Don, do we have any questions from our audience?
Yeah, I had a couple. There were a couple of questions that came in throughout the presentation. One of them was around getting their hands on the slides for today. What's our plan for sharing these slides today?
Yeah, sure, absolutely. What we're going to be doing is compiling this as a video. We're going to be then launching it on our YouTube channel later today. And as a result, you can not only go to our YouTube channel later today, go to YouTube, just search for 7 Signals, should come right up there. But in a follow-up to you all, we'll also provide the link.
All right, that's fair. Next question is around, are you able to discover issues with access points?
Oh, yeah, we've been talking so much about discovering issues with clients. That is a very good question. You know, remember, the Sapphire Eye is a client, and it's trying to connect to the access point. So if for whatever reason it can't, then in fact it will alert you and tell you that there is a problem with the access point. I'm thinking of an example right now of actually 2 of our hospital customers who discovered some kind of bug in their access point where the radio inside that access point was no longer broadcasting or beaconing. And to the controller, everything looked fine. But what happened was that now clients were not able to roam to that access point because the radio had gone silent, if you will. And if you can't roam to that access point because your device doesn't know or think that it's there, then what happens is it winds up sticking to an access point that's very far away. This drives down signal strength, which drives down your data rates, and you wind up having a very slow and congested experience. So this is something that we've been able to discover quite frequently with a number of our hospital customers. Very exciting, very good question. Thank you for that.
Yeah, and you know, we're talking about complementing the access point, and this is one of those cases where that comes in. So
Sure.
you know, if you're relying on the access point manufacturer to tell you if it's beaconing, there's often a bug or a disconnect.
Exactly. You know, I think this is a great, just like you said, it's the difference between an inside-out approach versus an outside-in approach, and how the two need to work together.
Right. The next question, always we get a question about pricing. So how are the products priced?
Oh, okay. So Mobileye is per device per year. So for instance, you would identify which workstations or tablets that you would want to put it on. Let's just say that it was 500, 1,000, 5,000 of these devices. And then it's simply a subscription. So it would be, for instance, $35 per device per year. And then with quantity, that goes down. If you do a 1 year or a 3 year term, that price goes down again. So that's very exciting. Now, from Sapphire Eye, it's per Sapphire Eye per year. Okay, similar. And what's important to note is that one Sapphire Eye, it has a very unique antenna array inside of it, giving it the ability to connect, like a client, to 4, 5, sometimes 6 access points. So we're not talking about some 1-to-1 ratio here, which would be really bad. One Sapphire Eye can cover a large area and connect like a client to many access points. And so one of those, again, if you go with like a 3-year agreement, it's $699 a year, and that covers everything. That covers absolutely everything: the hardware, the software, the maintenance, the upgrades, the new features, everything.
We really make it easy, and that having that software as a service methodology or business model really lends to great pricing that has a low total cost of ownership.
Absolutely.
Next question here is specific to the Sapphire Eye, and can it test roaming between the APs?
Well, actually, that's one of the reasons why we came up with Mobileye. Okay, because Mobileye is on the device, and that device has an adapter with a version of drivers in it, and those devices are moving back and forth, up and down the halls, everywhere, all the time. And so by putting Mobileye on the device, which runs very quietly and silently as a service in the background with no impact to the performance of that computer, we're now able to characterize the roaming behavior of that device as it attempts to roam from access point to access point. Now, one of the things, Don, that we do that's really neat in our software is we not only are able to look at your signal strength of your device, but we're also able to see the signal strength of neighboring access points. And this helps us determine if you're actually on the best access point or not. We'll actually be able to tell you if you should have roamed or not roamed, and we can identify that and bring that to you quickly and easily.
Okay. All right. I don't see any other questions in the chat room. I'll give it just a few more seconds. If we go to our next step slide, I'll wait for some more questions to roll in if they do. So while we're waiting for those questions, if we get one or two more, we'll have time for that. I want to make sure we stay on schedule with this presentation. We scheduled 40 minutes for this webinar. I don't want to go over. So for those of you on the call, we promised you a $5 gift card. So thank you, $5 Starbucks gift card.
We're going to buy you a cup of coffee.
We're going to buy you a cup of coffee today.
That's nice.
Yeah. So I will get that out to the group. So Andy will be getting 2 gift cards today.
Oh, wow. But I've got a question for you, Don. Can $5 get you a cup of coffee at Starbucks?
Well, if you're simple like me, you just have that regular cup of joe and maybe an espresso shot.
Okay.
I don't know about the lattes and the pumpkin stuff.
Yeah, like the quad venti, soy latte.
I don't know about that one. So I don't see any other questions coming in here. So what I'd love to do is talk about next steps. Please reach out to your sales director to schedule a live custom demo that's specific to your needs. We didn't get into a live demo here on purpose. We do want to tailor that presentation for your facility specifically. So please reach out to your point of contact at 7 Signal so we can get that conversation going. And if you have any questions and maybe you don't have the contact information from your invitation, you can reach out to me directly. My email address is don.cook@7signal.com. All right. Well, I think we should wrap it up today. Eric, well, thank you, everyone, for your time. Thank you for coming. Let's connect after this and talk through a custom demo for your hospital.
That's right. Thank you, Don. Really appreciate working with you today.
Likewise.